discussion on a clinical-based scenario about epilepsy, puberty, and pre-pregnancy. Aisha is a 15-year-old child who comes to the clinic with her mother. She had menarche at age 13 and currently has oligomenorrhea. Mother is concerned as Aisha has had epileptic seizures since age 5 and is now stable on medication. The mother is concerned whether epilepsy will influence menstruation. Epilepsy does not influence the age of menarche or the menstrual cycle after menarche. Almost all girls have irregularities in their menstrual cycles with the onset of menarche. For example, the menstrual cycle may be prolonged or even shortened. The menstrual cycle becomes more regular after a few years, and parents should not be concerned as the pattern will settle with time. If the menstrual pattern affects the child's school attendance or her daily life, then some medication may be given for a short time period. Very rarely, girls will start having seizures after menarche. Most of the time, children have already been diagnosed with epilepsy, and there is an increased risk of seizures with menarche. This is due to hormonal changes in the menstrual cycle. Estrogens excite the brain, and progesterone will suppress the brain. When estrogen levels are high, for example, when ovulation occurs or when the corpus luteum starts to lose its function and the relative levels of estrogen are increased, at these two times, girls with epilepsy may have a higher frequency of seizures. Even if they are well controlled with anti-epileptic medication, they may break through with seizures. One way to deal with this problem is to increase the dosage of the anti-epileptic drugs during the few days of the cycle. Another way is to prescribe oral contraceptive pills to provide more regulated hormonal levels for the child. Girls with epilepsy will have normal growth and will be able to have normal sexual function once they are married. She may have a decreased libido, but this is subjective and differs from patient to patient. Another condition seen in girls with epilepsy is the higher chance of polycystic ovarian symptoms, and this is seen more commonly in girls taking valproate as an anti-epileptic drug. The other concern that Aisha's mother has is that what precautions need to be taken when a decision is being made for Aisha to get married. This is a very good question that families may ask, and it is important for them to understand that Aisha and her main care providers should receive premarital counseling. Parents can truly understand the level of maturity of the girl who is getting married, and they should prepare the girl to care for herself and also to help her husband to have realistic expectations from his wife. The physician will have to align their delivery style of care to these realities. The girl has to prepare herself for the changes in her life and the way that she will be looking after herself. This is particularly so for taking medications on time and having regular checkups with the physician. There are many brain and systemic changes which take place at the time a girl is entering puberty, and these influence the ability of the adolescents to master the skills required for the independent management of their epilepsy as adults. In addition, the psychological and sexual development may also be affected. Husbands-to-be should always be informed and counseled about the patient's epilepsy so that they can provide the supportive treatment and care. After marriage, the couple should use contraception to delay the pregnancy until they receive pre-pregnancy counseling. Oral contraceptives may not be effective in the woman as the anti-epileptic drugs are enzyme-inducing and can increase the metabolism of drugs in the liver, leading to breakdown in the medicines and decreasing the effect of the drugs inside the body. Pre-pregnancy counseling will involve the following: an assessment of the medical condition of the girl, an evaluation of her status for the presence of seizures, a review of the drugs to identify if the drugs need to be changed to decrease the chance of teratogenicity. If there is a drug change, then evaluation of the plasma levels to ensure they are within the therapeutic range. Start folic acid to improve chances of pregnancy success. Couples should not try for a pregnancy until they receive a go-ahead by the physician, and they must understand that once pregnancy is diagnosed, they should report early. With this, we come to the end of this video. Please like and subscribe to this channel, comment and share. Thanks and goodbye.